Jesse is the Claire M. Hubbard Professor of Health and Environment in the Department of Environmental, Agricultural, and Occupational Health at the University of Nebraska Medical Center, which is my old home. He is also the director of the Water, Climate, and Health program at the University of Nebraska Medical Center and the director of the Water, Climate, and Health program at the University of Nebraska's Daugherty Water for Food Global Institute. So I think from that you can ascertain the point that the reality that Jesse has his fingers in many different pies and his expertise and research is focused on the understanding of impacts of changes in the environment and climate on natural and human processes. Today, Dr. Bell will be speaking on developing the nexus of water, climate, and health. So Jesse, the floor is yours.
Thank you so much for allowing me to be here today. I really appreciate it. And I'm really honored to be here and be able to tell you a little bit about some of the work that we're doing. I decided to switch up my title a little bit, and I went with Water Sustainability, a Wicked Problem and the New Abnormal. And I'm going to talk about that a little bit, about what we're trying to face and what we're trying to do over here at the University of Nebraska. Whoops. And so first off, if you haven't heard of this concept of a wicked problem, this has kind of been a buzzword that's been going around for a while. It actually predates recent times as well. But a wicked problem is basically an unstructured, difficult to solve problem that has multiple cause and effects, and it's difficult to get a consensus around problems and solutions of solving that problem. It's cross-cutting. It has a lot of overlapping stakeholders, and there's a lot of different perspectives on the problem. And it's also a relentless problem in that there's no once and for all kind of solving the problem. It's constantly evolving, it's constantly developing. And so that's the concept of a wicked problem. And there's a variety of different examples that you can think of. Homelessness, drug problems, things like that are considered wicked problems because they are quite difficult. And there's a lot of different people at stake and a lot of different players at stake. So then the reason I say new abnormal, this actually comes from a colleague of mine from NOAA. And this is a little play on words. So in climate and climatology, we think of normal as a 30-year average of weather and climate conditions. And that's what defines what a 30-year average looks like. And what that defines is what you expect the weather and climate to look like. And so about every 10 years, NOAA redoes the climate normals. Well, somebody deemed this as a new abnormal is because it's hard to look at the historical perspective to try to figure out what's going on today, because the weather and climate is changing so rapidly. We know that we've seen increases in droughts, especially in the western part of the United States. We've seen changes in flooding and flooding rains in other parts of the US. And so we've seen a lot of changes in our extreme weather all across the United States. And this is having direct impacts on our water cycle as well. And so this is kind of where this all comes together. When we're talking about water sustainability or just water issues in general, we either have too much, we have too little, or it's not clean enough. And so we have a variety of different problems that we have to face when we're trying to deal with some of the water issues that we're facing here in the United States and here in Nebraska, where I'm at, or Idaho, where you're at. And so that's where we're looking at that water, climate, and health nexus. Obviously, this is a very difficult problem. There's a lot of different stakeholders that are involved. There's a lot of different solutions. There's a lot of different opinions. And so in order to address this, you need to make sure that you're multidisciplinary and interdisciplinary and bringing together all these different ideas and all these different concepts to try to address this very difficult problem that's constantly evolving as we're moving forward as well. And so in Nebraska, we got really lucky. We had a donor that provided a gift of $5 million to the University of Nebraska to try to help tackle some of these issues surrounding water, climate, and health. And the whole premise is the donor was really interested in trying to figure out, how do we address these issues? How do we start to tackle some of these major issues that we're seeing here? Because this isn't a one-person solution. This isn't a small level solution. This is a very broad level solution that needs to be have multiple people and multiple players at stake or at the table. And so that's our mission. Our mission with this new water, climate, and health program is to develop interdisciplinary collaborations across the University of Nebraska system to address Nebraska's public health challenges around water and climate. And we're building this off of 4 pillars. And these pillars are research, education, policy development, and training. Because we're not just here to try to develop something for research sake, right? We're not just trying to, figure out what the next question is that we want to try to address. We want to try to build something so that we're actually having impacts in the communities that we serve. And that's going to be through education, policy development, and training to try to address some of these very complex issues that we're facing here in Nebraska. Now, I'm going to be talking a lot about Nebraska, and this is just kind of setting the framework for how this could potentially be developed in other places as well. So, there's things to learn and things to try to adapt from this system. And so one of the first things that we're trying to do is build bridges. Just to give you a little bit of a background on Nebraska and the University of Nebraska system, we have multiple campuses within the University of Nebraska and the University of Nebraska system. The 2 campuses that are the primary stakeholders within this are the University of Nebraska Lincoln, which is in Lincoln, Nebraska. That's where it's a large undergraduate campus. We do a lot of research. It's a land grant university as well. And then UNMC, University of Nebraska Medical Center. This is where our biomedical research occurs, public health research, and then also where we train our next generation of medical professionals, doctors, nurses, dentists, public health professionals as well. And so these are 2 separate entities that are separated by at least an hour's drive between the 2 of them. Historically, there hasn't been a lot of interaction between them. And that's part of what this new program is supposed to do, is try to build more collaboration between these 2 entities. And we're doing that through the Water for Food Global Institute and the College of Public Health. Those are our primary stakeholders. And that's coming all through the Water, Climate, and Health program that I'm the director of. And so, I'm the director of Water, Climate, and Health at the Water for Food Global Institute, and I'm also the director of the Water, Climate, and Health program at the College of Public Health. And so traditionally, Water for Food has done a lot of work looking at some of our water-related issues in Nebraska, everything from irrigation, agriculture, looking at contaminants in water, all this other stuff. And then the College of Public Health has been serving the opposite end. They've been looking at what are some of the public health threats and health threats that are facing Nebraska. And so through this collaboration, we're hoping that we can build a relationship that'll help with bringing together our experts in Nebraska's within UNMC and the University of Nebraska Lincoln as well. So we can see more collaboration to try to solve some of these very complex problems that we're trying to address. And so what are the issues that we're trying to face? Well, this is both water quality, and I'm going to talk about some of the water quality issues that we have here in Nebraska, and water quantity. And this is where that climate piece really fits in to all of this. And I'll talk about that to some extent as well. So what are the populations that we serve? Working in public health, this is where I came from before. I used to work at the Centers for Disease Control and Prevention. You look at the populations that you serve. And here in Nebraska, that's our primary focus, is in Nebraska, then the region, the US, and globally. But Nebraska is our first population that we serve. And so just to give you a little bit of background on Nebraska, 20% of Nebraska's population gets their water from private domestic wells. 80% comes from community public water systems. Agriculture accounts for about 92% of our land. 1 in 4 jobs in Nebraska is related back to agriculture. And there are about a little over 77,000 producers, agricultural producers in the state. Of the about 2 million people that live in Nebraska, 660,000 are in rural areas. And we also have 4 state and federally recognized tribes in Nebraska that have headquarters here in Nebraska. And then we also have neighboring states that have tribal representation as well. And so here are some of the water quality issues that we face. First, the one that probably grabs the most attention, I know that you guys have some issues there in Idaho as well, is nitrates. Nitrates in our groundwater have huge implications in some of our rural communities especially. And a lot of our rural communities are spending a lot of money to try to mitigate the nitrates in the water sources, to reduce the nitrates in water sources. This is one example from Hastings, Nebraska. They were in the process of putting up a water treatment facility to try to remove some of the nitrates. It was estimated at the time it might have cost up to almost $50 million for a town of 25,000 people. And why are nitrates so important? We know that nitrates have an impact, especially on infants, anybody below 6 months of age. There's a sensitivity. And then one of the blood disorders that can pop up from high nitrate or a nitrite exposure would be blue baby syndrome, which some of you may have heard of. It's also been shown that nitrates have a relationship back to different cancers, including gastrointestinal tract cancers. And then also there's been some work that has shown that it's possibly related to developmental effects as well. And this is just to give you a little bit of, so this is Nebraska. There's two maps representing Nebraska. The top map is groundwater concentrations of nitrates by county across Nebraska. The orange and red are indicating any county over 1980s to near present that exceeded the EPA standard for groundwater concentrations of nitrates. And then over on the other side, we see atrazine on the right side of the screen. And anything above 3 is the EPA concentration of 3 micrograms is above the EPA concentration of atrazine in water. That's surface water. And the reason I pull this up, the reason I show this, is that sometimes there's overlapping effects that occur with different agrochemical exposures. And we have multiple different issues with agrochemicals here in Nebraska. So not just nitrates, but also atrazine. And there's been some work that has actually shown that the combination of atrazine and nitrates potentially is leading to pediatric cancers that we're seeing in certain parts of the United States and globally as well. We also know that we have naturally occurring uranium in the ground in Nebraska and also other places in the Great Plains region. And when you have nitrates, there's been some work that's been done here at the University of Nebraska that has shown when you have nitrates in the groundwater, it actually can pull up that uranium and make it solid or make it available within the groundwater itself. And then we have arsenic issues. There's certain places in Nebraska that have had to shut off wells and shut off different water sources because of arsenic exposure. And anybody that's familiar with arsenic is familiar that it's an ancient poison. They used it a lot to kill people back in ancient times. It also can cause stomach irritation, blood disorders. You can see if you get high exposure, darkened skin. You can see corns or warts on the palms of hands and soles of feet, skin cancers, and also other cancers as well. And then, I'm sure a lot of you have paid attention to what happened in Flint, Michigan a few years ago with the lead exposure within the infrastructure in that region. Well, here in Nebraska, we've actually, this part, actually where I'm at right now, has been deemed a Superfund site because of lead exposure, because of a lead plant that was in this region, which one of the things that we've seen here in Nebraska is that children in Omaha had high rates of lead in their blood back in the 1990s, and it's been slowly going down since then. But we also have very old infrastructure here as well. And there's a lot of houses and old houses in this part of Nebraska, in this part of Omaha, that still have lead pipes for water, lead water pipes in those homes. So And lead, one of the things that's most striking about the impacts of lead on human health is the developmental and cognitive issues that children can have when exposed to it. It can also lead to miscarriages, stillbirths, and infertility. And there's a variety of other issues that can potentially happen as well. So this is just kind of showing some of the outline of some of the issues that we're facing here in Nebraska as far as water quality is concerned. But we also have issues that we know about as far as some of the health issues that we've already seen here in Nebraska. So first off, pediatric cancer incidence rate in Nebraska is one of the highest in the United States. We have one of the highest rates of pediatric cancer in the US. And the way that cancer is distributed across the state isn't equal. It's not every county is very high. Some counties are higher and some counties are a little bit lower. And so the orange and red indicate counties that exceed the statewide incidence. So we already have one of the highest incidence rates in the US, but certain counties have higher than the statewide average. And we also know that we have a very high incidence of pediatric brain tumors. And here in Nebraska, our pediatric brain tumors are predominantly, the highest incidence rates are on the eastern side of the state, which is also where we know that we have some of the highest issues, or some of the strongest issues with nitrates and some of those other agrochemical contaminants as well. We also have issues with birth defects. The national average is 3.3% for birth defects of all live births. In Nebraska, from 2005 to 2014, it was 5.8. And certain counties in Nebraska have actually reached up to almost 12% of children born have birth defects, some sort of birth defect. So that's just talking about some of the health issues that we're facing in Nebraska and some of the challenges that we face moving forward. Now going to the water quantity issues. Now here in Nebraska, we have very variable climate. We see a lot of flooding. We're actually one of the most flood-prone states in the United States. A lot of times when you think of flooding, you think of coastal areas, but actually here in Nebraska, we have, we're actually one of the most flood-prone states in the US. And we also have a lot of droughts. We're actually in a drought right now. And we know that our climate is changing. We've seen an increase in temperature over the last 50 to 100 years. And we've also seen a change in precipitation over that time period as well. And so here in Nebraska, it's actually gotten wetter over the last 50 to 100 years. Idaho, it's gotten a little bit drier. And we expect that climate is going to continue to change, and our precipitation patterns are going to continue to change in the future as well. And so these are climate models projecting out into the future. We expect here in Nebraska that our winters are going to get wetter and our summers are going to get drier. And we understand what those wet winters actually mean. Because last year, we saw one of the wettest 12-month periods on record. No, it was actually, I think it was the wettest 12-month period on record in US history was last year. And that record went through the winter, and especially in places like here in Nebraska, we received a lot of winter precipitation, which fell as snow. And then when we hit March, we still saw a lot of precipitation, and we saw a lot of runoff and snow melt. And that led to statewide flooding that impacted multiple communities throughout the state. It was ended up being the costliest inland flooding event in US history. Total, it was cost the United States at least $10.8 billion of economic loss. There were hundreds of people displaced and at least 3 deaths. And so solutions. Obviously, we face a lot of challenges. Every state faces a lot of challenges when you're talking about issues related to water. And this is why I think public health and identifying the impacts of health are so important. Because we already understand a lot of the solutions to the problems that we see. But it's about communicating and understanding what that means to us. by educating the public so that they better understand the impacts of some of these environmental issues, what they have on our health and the health of the people around us, enhancing the monitoring so that we can improve our understanding of the health impacts that our communities face when these types of things occur, performing research so that we not only better understand what's occurring now, but also better understand what's going to be occurring in the future as well when we're talking about water quantity and water quality issues. And then contributing to the dialogue. Because when you're talking about how to address some of these issues, it's important that public health and healthcare have a seat at the table so that they can help address some of these issues moving forward as well. And the reason I talk about this is that, like I said, we know what some of the solutions are. So I've mentioned nitrates and how that's a big issue here, and it's also a big issue, or it's an issue in Idaho as well. Well, we know how to treat that problem for the most part. You know, cover crops, efficient irrigation, precision fertilizer application. These are things that are well known. So my hope and my goal is to make sure that we have, like I said, public health and healthcare at the table so people understand what the implications mean when we don't make these proper choices, or when we continue to see these types of issues manifest and expand in the future as well. So what comes next for us? We're doing a lot of things through this program. We're going to be working on developing student fellowships. We're going to do pilot grants to try to build bridges and bring more people together that are doing diverse research. We want to understand the problems that we're facing. So we want to have summits to bring together experts across the state and across the country to talk about some of these issues. And then we want to make sure that we're educating our next generation of problem solvers as well. And for me, that's really important that we have people here at the University of Nebraska Medical Center, because I want medical doctors, nurses, public health experts to be able to go out into the community after they graduate from here and understand what some of these challenges are, so that when they're in those communities, they can be a conduit for change. And so, you know, with developing these types of programs, with building these types of bridges, you're trying to work towards a safer and healthier state. And that's through identifying multidisciplinary solutions, building collaborations, educating and informing the citizens on what the impacts are potentially going to be, providing mentorship so that we have the next generation of problem solvers that can help tackle these issues, and then recruiting experts as well, so that we can bring in more resources into the state to help try to move forward on some of these issues. So with that, I just wanted to thank my team and also the people that were responsible for helping make this possible, which was colleagues from here at the University of Nebraska Medical Center, and also colleagues from University of Nebraska-Lincoln. If you have any questions, don't feel free to contact me or the program manager of Water, Climate, and Health Program, Megan Langle. And with that, I just want to say thank you very much for your time, and I really hope that you're the ones that are working on being the next generation of problem solvers for the problems that you're facing in your state. And so, thank you so much. I really appreciate it.